Hi, I'm Dr. Grace Wright, rheumatologist and consultant in New York City and president of the Association of Women in Rheumatology. Welcome to this discussion on the importance of mental wellness for patients living with inflammatory arthritis. Joining me in today's discussion is Dr. Susan Bartlett, professor of medicine and clinical psychologist at McGill University in Montreal, Canada, and adjunct professor at Johns Hopkins Medicine. And we're so delighted to have her. Dr. Bartlett, thanks for joining us.
My pleasure.
So, before we begin, I want to mention that this discussion is part of a certified educational activity provided by Medscape Education and is supported by an educational grant from AbbVie. So we'll sort of create some context here because as a rheumatologist, we're often treating patients with chronic diseases, autoimmune diseases, and inflammatory arthritis. And we've learned to understand that our diseases go beyond the scope of the bones and the joints into so many other domains, whether it's the heart, the lungs, other aspects of wellness. And a very key component for our patients is our mental health and wellness. We know that the pain and function impact them in many ways because it impacts their quality of life, impacts their ability to have the social connectedness that they may like to have. But beyond that, it's also part of the disease process. And so we have to sort of co manage mental health and wellness as we manage inflammatory arthritis and understand the impact on that person's lived experience, not just a metric that we check off. So, Dr. Bartlett, I'm going to turn to you now and just ask you to help us understand how do you identify people who need some more assistance in sort of uncovering and discussing their mental health and wellness?
Well, Grace, I think I'll start by saying that I've had the good fortune of being a faculty member in rheumatology for about 25 years now. And my office has been in the rheumatology suite. In fact, for many years, my office was in the rheumatology clinic at Johns Hopkins. So I had a chance to observe patients when they were coming in, to interact with them directly, and also to speak with my colleagues, the rheumatologists and the nurses within the Hopkins Arthritis Center and hear what some of their dilemmas were. You know, when we first started talking about this 25 years ago or so, it was kind of hard to get a little bit of traction with talking about mental health. But now it seems to be very much at the top of many agendas. And I think in part that's because of COVID. We've really seen how COVID had such an impact on mental health. But what is clear is that this is not a side issue, or this is not something that can be relegated to the internist or the family doctor. Mental health is very much part of what impacts our patients' ability to manage their disease, to self manage. It also affects their disease activity. And importantly, it impacts nearly 1 in 2 people who have inflammatory arthritis. These challenges can affect everything from the pain that they experience to how adherent they are to our treatments and their quality of life, their ability to continue to remain active in the workforce. So I'm really excited that we're talking about this because I do think that mental health needs to be part of every conversation about inflammatory arthritis care.
It's so interesting that you emphasize the duality that this is actually part of everything that we do. And so the next challenge that we face is as rheumatologists, we're managing cardiovascular health, we're managing endocrine health, we're managing all aspects. And many of my colleagues and I myself sometimes feel overwhelmed and overloaded. So how do you make sure that number one, are as providers we are well resourced to do this? What are some of the tips and tricks that we can use to make sure that we have the appropriate resources? And how do we make sure that our patients also have appropriate resources? Because we don't always have a Dr. Bartlett sitting in the room next to us to assist us with this. So what do we do?
Well, I think first it starts with identifying who may be in distress. And there are some red flags that are generally apparent, quite apparent, when a patient comes in for a visit. Let's run through a few of them because some of them are behavioral and some of them may come out in the conversation. But one of the first things you want to look for is any significant change in physical function, change in patient reported outcomes. So, if you see something like hack scores or physical function, if you're measuring it a different way, any of those scores, if they increase significantly, if you see an increase in fatigue or sleep disturbance or more pain in everyday life, those are important signs that you can monitor in terms of patient reported outcomes that um, should lead you to having a discussion with the person about how they're doing overall. But there are some important behavioral indicators too. The patient who's more quiet, the patient who may have canceled a couple of visits. Interestingly enough, often when patients aren't doing well, their tendency, at least when they're not doing well from a mental health perspective, their tendency is to withdraw and not come in. They want to wait until they're feeling a bit better. What I'll generally say to patients is, the days that you least feel like coming in for a visit are the days when it's probably most important to get there. So, withdrawal, canceling of appointments, um, difficulty adhering to treatment, or people who express some frustration about their treatment not working well enough, or frustration with the care they're receiving. Uh, People who talk about feeling overwhelmed, feeling greatly fatigued or hopeless. These are all important behavioral signs that also can indicate somebody's mental health is not doing as well as they had been doing
Mhm,
previously.
mhm. And as I'm listening to you, I'm thinking that so often we just say, "Oh, this person has fibromyalgia as a comorbidity," and so that just gets the label, and we're off. Or we say that this person is non-adherent, and so we blame them and shame them for not adhering to the desired therapy rather than getting to the bottom of, because it takes time to delve into that. But perhaps before we just put a label on, we should think of the why behind the behavior, to have understand to how to direct that person to receive appropriate care and encourage them rather than shame them or reprimand them, which is sometimes what happens in busy healthcare systems where, it's multiple people touching that person. And so we push them away when they need us the most to pull them in.
It's an excellent point, Dr. Wright. And I'm really glad that you brought up the issue of treatment adherence because, the most robust predictor we have of somebody who is going to be non adherent to treatment is their depression score. So I'll say that again because it's really important. The best predictor we have of non adherence is depression. And that's across all diseases, that's not unique to rheumatic diseases. But how do we get at that? How do we encourage that conversation to come up early in the visit rather than at the end of the visit, when your hand is on the doorknob and you're about to leave?
Yeah, I do know though. I just remember going back now years, maybe even decades, sort of thinking about interviewing skills, how it's such a reflex. I say to you, "How are you doing?" And you say, "I'm fine." It's a reflex. It has nothing to do with how I'm feeling. So, what I've tried to do more than saying, "How are you doing?" is, "How are you feeling?" Because I get fewer of those reflex responses, but it also allows me to anchor myself to, I really want to hear what this person is about to say, because they're going to share emotions and ideas and thoughts and not just give me, "I'm fine. How are you doing?" Which is sort of that social response, which is not what we want to have, right? That's just the door opener. So give me some, other ways that you might phrase this, to start that conversation so that we sort of practice a way to ask the question so that we can receive the response that we really need to receive when it comes on to mental wellness.
I think one way that you can do this always is to ask people, do you ever feel anxious or down because of your symptoms or because of your arthritis? That's kind of a permissive stem that we're giving when we say because of your arthritis. And it really opens the space, I think, for somebody to say, it has been a little bit harder more recently. I like what you're doing too by just asking about feelings or how has it been? There are times when it's easier and it's harder to deal with your arthritis. I'm wondering what's going on for you right now. So I think if you can ask direct, but compassionate questions, you can open the door and you can allow the space for somebody to begin to talk about what they're feeling. Interestingly enough, sometimes it takes a couple of minutes, though, for people to warm up. And we found that in one of the studies that we did at Hopkins a few years ago. We were giving people patient reported outcomes. In our case, we were giving them the Promise 29. And it's a quick questionnaire, very much like the SF-36, but this one is much more actionable. And it has questions about anxiety and depression, 4 questions each. And so, one of the things that patients told us was that they really appreciated filling out this questionnaire in the waiting room before they met with the rheumatologist because it stopped them for a few minutes and it got them to think, well, what's my pain been like recently? How am I feeling? How is my sleep? How is my mood overall?
And it also prevents that feeling of the panic that you get when you feel hijacked. So when you're sitting in the waiting room filling it out, you have time to reflect. When the healthcare provider walks in and asks the question that you feel you have to answer immediately, sometimes there's a little bit of panic, and you can see that in eyes like, I've got to answer this right. I've got to answer this quickly. I don't want to waste, my doctor or my APP's time, or whoever the provider is. And so by giving them that sort of quiet space to do this, that's an excellent cue to know that you can have a space to do this, which it means also that wherever they're waiting in the waiting room has to have an environment that allows them to be reflective, right? So that we don't have chaos and all of that in the waiting space. So thank you for those cues because I think those are actionable, practical things that we can do. So now we've opened the door, right? Because I've asked the question appropriately. I'm getting responses, and here's where the panic comes in. What do I do when they tell me I'm not doing well? I'm anxious. I'm depressed. I spend so many more days crying. I can't function. What's the next step?
Once you've opened the door, then you're in a position to be able to talk with people about how it's affecting their arthritis. And I think that switching the direction of the conversation back to the arthritis will lower the intensity quite a bit for many people. In the same way that physicians are often concerned about raising this question, I don't want to open this can of worms. I don't have 30 minutes to be able to deal with it. Patients often feel similarly. They worry that this is not something that their physician is going to think is appropriate for them to discuss with them. This is my rheumatologist who takes care of my joints. I'm not sure that this is the right place for me to raise it. It is the right place for it to be raised, but I want to reassure rheumatologists who are listening right now, it's not your responsibility to try and manage this. It is more than a rheumatologist can manage, but what it is an opportunity to get other members involved, so mental health professionals specifically. Generally, these conversations are not going to take 30 minutes. You can have a good conversation, a productive conversation with a patient in 3 to 5 minutes. What it is going to do is basically validate for the patient that their feelings are important and that their feelings may be impacting their disease directly. So it may be that their disease is even more active because of depression. We have seen that repeatedly over the last 10 years. As depression scores go up, so do disease activity scores. It's certainly impacting their ability to self-manage. It's affecting their sleep on a daily basis. We all know that when you don't sleep well, it's really hard for anything to go right in your life. So just sort of getting some of this out there and then being able to acknowledge this is not something that I have the skills to deal with directly, but let's figure out where you can get some help with this because it is important. It will make a difference and it'll help you with your arthritis. I think it'll help you manage your arthritis more effectively.
Oh, that's absolutely excellent because I know, just speaking to many of my colleagues, that that's it. I don't have the time to manage this, so why am I going to open that door? Because now I feel responsible and I don't feel equipped with time or with resources to help this person through this, right? So it's really good to know that there's a way to bring it back to what we're talking about, but to then make sure that we can direct this person to adequate resources. So I know you're a clinical psychologist. Who are the specialists, the colleagues that we can use to help? I know we always think psychiatrist, and that's the end of the list, but it clearly is not, right? Give us some idea of the various specialties that can help us with this.
Well, I think one of the things that we're facing everywhere, certainly in Canada and I know in the United States, is a true shortage of mental health professionals. Not only that, there's still a good deal of reluctance on many people for the idea of going to see a psychologist or a psychiatrist. The good news is that probably 80% of the people who have some mental health challenges may not need someone with my level of expertise. There are many things they can do from a self management perspective that can really make a difference. For example, one of the things that we've learned in the last 15 to 20 years is the importance of regular physical activity. Physical activity is a very important antidote to both anxiety and depression. In fact, it's so important that in Canada, the Canadian Family Physicians Society has deemed it the first line treatment for everybody with depression. So, just asking people what they're doing, helping them to get more physically active. They're not going to want to do it. They're not going to feel like doing it, but just, moving your body, engaging muscle. And when you move muscle and you do it regularly, it does have an effect on all of the body. I think it's really helpful too to link the inflammation of arthritis back to the fact that that inflammation is not only affecting their joints, but it is affecting their brain. And we've learned a lot about this in the last few years that when people have that cytokine storm, these are chemicals that really disrupt mood in a very profound way. They leave people feeling much more tired. They induce a brain fog and they cause depression. So, helping people to recognize it's not just psychological, it's not all in their head. There's a very important biological component. And that's what I think makes it easier to talk about self care and the importance of physical activity, the importance of making sure people are getting enough sleep. For women who have young families, that can be particularly challenging, but it really does start with basic good self care, eating well, sleeping well, being physically active, doing what you can to lower your stress.
Yeah, those are fantastic. And I've also found that just helping people organize, I said, how do you organize your day? Because when you sort of, you have the kids and you have the parents and you have your work and your home, it becomes overwhelming and frustrating. So if you can organize, and I say sometimes I make a calendar of what I need to do so that I don't have to think about it. I just follow my calendar. Here are the things. And in that I put stand up and walk around for 5 minutes because it sort of, gives me I allotted time for this, and I think we are the wellness coaches for our patients, whether we sit in the rheumatology bucket or we sit in the mental health bucket, right? That's part of what we have to do because it's going to impact their overall function. So this has been absolutely fantastic, and for me as a rheumatologist, I have learned so much today to say, well, number one, it's important for us to open the door and ask the question, ask it in a way that is permissive, that's non-judgmental, that's non-shaming, and then listen, bring it back to the focus of what we're dealing with in terms of their inflammatory disease, and tie that into things that they can do that are easy, not a 50-pound lift, but a 5-ounce lift. Just get up and walk around for a few minutes. And then we can expand from that. So those were my takeaways.
I think what really gives me hope these days, Dr. Wright, is this shift we have towards patient centered whole person care. We are seeing that more members of the rheumatology team uh, have training in mental health as part of their undergraduate training, really overall. And we're seeing teams now include social workers, patient navigators, and even some psychologists. Patients themselves are really speaking up. They're talking to each other, they're supporting each other, they're sharing their stories. And all of that together is very powerful. It's helping to change the landscape and it's making mental health part of routine arthritis care.
Oh, that is fabulous. And it also addresses the issue of the level of literacy that's needed if it's driven by the patient as well, right? Because they're speaking in language that's appropriate to them. It's not this sort of medicalese type language. So that is absolutely fantastic. I thank Dr. Bartlett for joining us for this. It's been a pleasure having you share this space to help us understand, number one, the importance of mental health in managing inflammatory arthritis and the importance of inflammatory arthritis in driving mental health issues. So, with that, we thank you for today and welcome everybody to reflect on some of these discussion points. Thank you so much.